Hi everyone, I'm Danielle Denise and welcome to my channel. For those of you who may not know me, I am an entry-level Master's of Science in Nursing student to become a psychiatric and mental health nurse practitioner. In today's video, I'm filming a few of my frequently asked questions about my program and about my school and just types of programs like mine. If you haven't seen my previous videos, I will leave them in the info cards up above for you guys to check them out after you watch this one. So let's get started with some frequently asked questions. Most of these questions and the idea for this video came from I get a lot of the same questions in my DMs, and I don't want to sound rude when I'm like, oh, I filmed a video on this, or I'm just starting to give like shorter answers for some of the questions that I get because I'm like, I've already answered this, but they don't know that I've, like, you guys, if you ever ask me a new question, you guys don't know that I've answered it before, but I'm giving you kind of like a drier answer because I'm known for like typing paragraphs. But it came from that, and then a conversation that I had with another subscriber named Krista. I think that's how you say her name. Hi, Krista. So let's go ahead and get started with these questions. So the first question I get a lot is, what school do you go to? So my school's social media policy prevents us from sharing certain information. And right now I feel like if I give out what school that I go to, it'll kind of lead to a domino effect of, okay, well, this is the school she goes to, so these are probably the hospitals she goes to. And if I ever share a story about any patients, somehow it all trickles down to equal a HIPAA violation. And that's what they want us to avoid. So I can't share that with you guys just yet. If there's ever a point where I'm able to, I will. And then also for my safety, I know I'm not like a big YouTuber, but crazy things happen and I don't really want to share that. I know there are some people who have found my channel and they're like, hey, I go to that school. Okay. The next question I get a lot, besides what school do I go to, because people typically ask me this so that they can apply there. They also ask me recommendations for schools to apply to. So I have made videos about finding the right program for you, finding schools that offer programs like mine, and things like that. Videos, again, will be linked in the info cards. I can't tell you where to apply to. It's basically all individual based on where you want to go to school, what state that you're in, things like that. The next question I get is, how do you afford your program? Loans. All loans. I don't work. I live on loans in my savings, but mostly loans. I'm gonna be honest. These grad school loans are a different beast, but luckily I didn't take out a lot of loans in undergrad. I was mostly in school on scholarships and grants, so I was blessed enough for that I was able to take out loans now so that it wouldn't have as much of an impact on me as it would if I was compiling loans on top of loans. The next question I get is, can you work during the program or can I work part-time? It is recommended that we don't work. And the way these past 2 semesters have gone, I would highly recommend that you don't work. You will drive yourself borderline crazy if you're not really big on time management. But if you do have a job in the hospital, people have done it, people are doing it, keep it, and that'll really keep your foot in the door for when you're graduating from this first portion, when we become BSN RNs, and you can apply through your hospital for jobs, because most hospitals take from people that are already working there. So you're already ahead of the game if you keep your hospital job or your like small clinic job or wherever you work like that. I would also recommend that you choose a job, or if you have a job where you're like sitting down and you have like a lot of free time so that you're able to study or do work in between, like school work in between your job working. But again, it's not recommended that we work. This program is very rigorous. A lot of programs like mine are pretty rigorous, whether you're doing an ABSN or a MSN. Just keep in mind, like, it's a short amount of time. If you're doing like an ABSN, you'll be back working soon. And if you're doing a program like mine, you'll be working as a nurse soon, and you can afford to go part-time, at least part-time. Next I get, how long is the program? In the world of accelerated nursing, I know I've made videos on this before. So your ABSN, you're looking at maybe less than a year to a little over a year. programs like mine specifically. I'm in an entry-level Master's of Science in Nursing program where I get a BSN and an MSN. My BSN is the length of an ABSN program, about 5 semesters, and my MSN portion is however long I want to take, whether I go part-time or full-time. But in total, both the BSN portion and the MSN portion will run me almost 3 to 6 years. There are other programs where it's just a direct entry MSN, and that'll be 2 years. There are other entry-level masters that are 3 years, but mine specifically will run me a total amount of time, 3 to 4 or 6 years. Okay, so going into some of the deeper questions, like the ones that Krista gave me. The question is, do I feel like the direct entry program makes me feel as prepared as a traditional BSN or MSN program? Okay, so my MSN will be traditional. I'm not there yet, so I can't speak on that part yet. But as far as the BSN, so far I feel like I will be prepared, especially hearing from nurses that have come before me. They've said that our program has really prepared them well. But then on top of that, that you won't really know what it's like to be a nurse until you're in the field. And even then you're still growing from like a year out to when you first started working as a nurse. The next question I get is, did you shadow any nurses and NPs before applying? I did volunteer at a hospital before, and that then is when I thought, I do not want to be a nurse, because they seemed so stressed, they were unhappy, at least they appeared unhappy. It's just so many things. That's why I didn't want to become a nurse to begin with, was from that shadowing experience. But turns out I ended up here anyway. I do have different opinions now. I would still recommend to shadow an NP or a nurse, because it'll give you a pretty good feel as to what it's all about. It's the best option for clinical exposure. I would say working. I did a couple like videos of entry-level healthcare jobs that don't really require like a degree or anything. I would say do that, volunteer, shadow, like the last question. Make sure that you do that so that you get like a feel for the environment and you kind of get to see how all these different healthcare professionals work, what their titles involve. You might not want to be an NP. You might want to be a clinical nurse specialist. You might want to be a hospital social worker. You might want to be a licensed clinical social worker and do therapy. You never know. Like, you'll just see so many different things. So I recommend that. A lot of people choose EMT, so you can definitely do that. A lot of people get that done over like the summer or winter breaks, so I would recommend that. I've seen a lot of people do it. I didn't do it, but I recommend it. And for nursing, I would recommend becoming a CNA, especially if you want to get the feel for nursing and really interacting with patients. I think CNAs work with patients more than nurses do, and nurses see their patients a lot, but CNAs have more time to really talk to them and get to know them and not worry so much about having a lot to do as far as like the plan of care. Get me? Yeah. GPA. I want to say don't worry about your GPA too much. If you guys have found me from my how I got into grad school with a low GPA, apparently people say my GPA isn't that low, but listen, in comparison to my cohort members, their GPAs were up there, okay? Again, as I say in most videos, you can be let in on like a conditional basis, so still give it a shot. If not, really work hard while you're out of school to retake some classes if you have to. If that'll help, bring your GPA up, but don't stress about it too much because you might be able to get in. They also look at the applicant as a whole. They want to make sure that you're a well-rounded individual and that you have your foot in many different avenues and that you're just a good person, especially in your interview. Just showcase yourself and your abilities and your passion for nursing. Let that be shown. But if you're looking for a GPA to hit, at least a 3.5 is a goal. I talked about in my videos, I think, what was my overall GPA? A 3.3, but my like prereq GPA, it was up there. It wasn't a 4.0, but it was up there. So that is my advice for GPA. Another question I get is why nursing or why NP specifically? I think I have a deeper reason than what I gave in like why I chose nursing over MD. video, I chose nursing really because I had like this epiphany that out of all the jobs that I've seen and out of everything that I wanted to be, what fit my description, I like kind of wrote everything out of what I wanted from a career and what I wanted to be able to do. I found Psych and P, and I kind of just worked backwards. I had a vision for myself in my life and what I wanted and how I wanted to help people, because a lot of us say that we want to help people, but in what way? So I went there first, and what fit that was Psych and P. So I worked backwards, and I am working backwards, but now I'm working towards that goal. It was a very surreal experience when finding out that I wanted to be a Psych and P, and then finding out that the program I wanted to apply to was a program that I had looked into for like 3 years in advance, and I would always put it on the back burner, like, nah, I'm not gonna do that. And then like I was going through old like brochures or like pamphlets or papers about the program, and when you flip the back, like one of the last like NP specialties that they showed was Psych and P, and I'm like, I've never paid attention to that. Yeah, it's pretty crazy. It was a crazy experience, and more than anything, it feels like it's meant to be, and anything worth having is worth working for, and this program is putting me through the ringer, but I'm working for it. I'm trying my best. Last question is, what am I most excited about or scared about in the program? I think that I'm just excited to get through it. I like the content, I like the material, which I did not feel in undergrad, so it keeps me motivated to keep going. I'm excited to be in a profession that is so well received and so well acknowledged, but the nurses seriously deserve so much more. Y'all don't even realize what nurses go through. Like, I understand why the nurses I saw so stressed and so upset were going through. Like, nurses are superheroes, man. I'm really excited to become a nurse, and I'm excited to be here. Like, literally, I dealt with imposter syndrome at the beginning of my first semester. I honestly still feel it sometimes, but every semester I make it to, I'm just like, I'm just happy to be here. Like, that's all. I'm just excited to be a nurse. I'm excited to be in the program. It's a wonderful feeling, and I'm so grateful for it. So that is where I'm gonna wrap things up for this video. I just wanna thank you guys again so much for tuning into videos on my channel. I appreciate it beyond what words can explain, and I thank you guys so much for getting me to 1,000 subscribers. Like I told y'all, I try to leave that out sometimes, but I can't believe I finally made it. It's been a few years, and I'm excited. I'm so thrilled to see the growth of my channel and to see where it's gonna go. So I thank you guys for being a part of my wonderful YouTube family. Be sure, if you haven't already, to give this video a thumbs up and subscribe, and I will see you all in my next video. Stay safe, stay healthy. Goodbye.